Hello, welcome. Today we're going to be looking at the risk a person would have taken if they did not take a vaccine for COVID, shingles, or the flu. Now, we've been told we must follow the science and look at the key aspects of what science is telling us. So, whenever there's a new vaccine that comes out, there have been clinical trials using a control group, and which is not taking the vaccine, and then the vaccinated group. So we're going to learn about the absolute risk reduction or the risk difference and the number needed to vaccinate to prevent one infection that comes from these clinical trials. Pretty interesting stuff. Okay. Now, an absolute risk reduction or ARR or the risk difference if you take a vaccine. So this percent represents the proportion of patients who are spared the adverse outcome as a result of having received the experimental rather than the control therapy or the placebo. So this absolute risk reduction gives us the number needed to treat, NNT, or number needed to vaccinate to prevent one infection. So you take a control group, which has not taken the vaccine, and also a vaccinated group, and you watch and see what happens over a period of time. That gives us the number of people who were infected in one group and were infected in the other. You simply subtract the difference between them and divide it by the number of people in the control groups. That will give you this absolute risk reduction. So let's take a look at what they were. So we know that there is, say, common pitfalls in statistical analysis about these trials: the absolute risk reduction, the relative risk reduction, and the number needed to treat. Remember, the absolute risk reduction or risk difference represents the proportion of patients who are spared the adverse outcome as a result of having received the experimental group compared to the control group. So, did it stop transmission? And we'll tell you what the absolute difference was between those two groups. Okay, here are the absolute risk reductions for various COVID vaccines. Remember, it's also known as the risk difference if you don't take it. AstraZeneca, 1.3%. Moderna, 1.2%. Johnson & Johnson, 1.2%. Pfizer, 0.84%. These values represent the absolute decrease in risk of contracting COVID after receiving these respective vaccines compared to the placebo group. This is also used to find the number needed to treat, the number needed to vaccinate to prevent one infection. In this example, we see that the Pfizer vaccine, jab, would be 119 people had to take that jab to prevent one infection. So we want you to be a good medical consumer and know the facts. So the absolute risk difference, if you didn't take the vaccines, was 1.3, 1.2, 1.2, or 0.84. Know the science. Be a good medical consumer. Follow and look at the science. Now, here we have reference charts telling us for most of the vaccines. Notice you see how they range from 0.84% to 0.24%. The numbers needed to vaccinate are 119 for Pfizer, down as low as 82 for the Norvax. So these are numbers that you'd have to treat that many people to prevent one infection. Let that sink in for a minute. We were told that if we were vaccinated, it would prevent transmission from all variants in September 2021 by the Center for Disease Control. It was in Biden's executive order issued in September 2021, and he quotes the CDC as saying, if we take the COVID vaccines, it will prevent infection from all variants. Well, when they were telling us this, the absolute risk reduction was 0.84%, 1.24%, 1.1%, 1.19%, 0.93%, 1.23%, 0.76%. So if the absolute risk reduction or risk difference was averaging 1% or so, How was that going to stop transmission for the majority of us? If the number needed to vaccinate was 119 people to prevent one infection, or 131 people to prevent one infection, or 90 people to prevent one infection, how was that? What's that word we want to use? Effective in stopping transmission. No, they say it was, but we want to know the facts. Let's jump to simply like the absolute risk reduction for the flu. Well, the flu vaccine is only 1.4%. Aren't we told to help Grammy? Aren't we told to help our neighbor? Aren't we told to be a good medical consumer and get vaccinated now? Yes, I think we are. And know what the absolute risk is, or the risk reduction is, if you take these modalities. 1.4% absolute risk reduction. Let's take a look at what it would be for preventing shingles, herpes zoster virus. Now, you can see down here, the absolute risk reduction is 1.7%, with the number needed to treat being 59. To not have any pain. At the bottom here, we take a look and we see what the reduction is for not having pain. Now, that is number needed to treat 362 people to have a reduction of 0.27%. That means not having pain from shingles. The absolute risk reduction would be 0.27%. But we're told we have to get it. We'd have to vaccinate 362 people in order to prevent one infection. Now, I want you to think about these things. I want you to think about the risk reduction, risk difference for the flu, 1.4%, the risk reduction for the different types of COVID vaccines, and the risk reduction for shingles. If we understand what the absolute risk reduction is, we can make good decisions as good medical consumers. Thanks for listening. Hope you helped understand more about these modalities that we're being asked to take. Thank you.